So let's start from the beginning.
Yep.
So you decided to get your master's, right? Do you think you'll ever become an NP? Do you ever think you'll ever, do that path? Or do you want to be advanced practice nursing? Or do you just want to be management behind the desk, not bedside nursing?
I never want to lose bedside nursing. I actually want to integrate it. So I have the role of attending nurse in mind.
Yes.
That I would want to develop within the major Boston area. So
I don't know what an attending nurse is.
Well, I am so happy you asked what it is. So, an attending nurse is sort of like a clinical nurse leader. It's adapting the roles of an educator and a leader and a manager all in the unit, but you're making the connections that you need within the multidisciplinary team and bringing them to the bedside. So, you round on your patients. Every single patient on the unit. What are your goals today? What can I do to make your stay better? Patient satisfaction, optimal patient outcomes.
Okay.
You're focusing on that. Then, hey, you know what? What do I need to do to make that happen? Do I just need to drag the doctor in here to talk to you about your exams? Do I need to get case management or social work involved? Do you want me to get them for you? So round, do as much as you can. Halfway through the day, check in again. Did we achieve these goals yet? Are they achievable today? And then at the end of the day, do the same thing. So it's a leadership position that is still by the bedside. But if the nurses need an extra hand, I can hang a bag of heparin with them. I can change a patient. I can still be with that patient care aspect.
Okay.
But a leader.
But a leader on the unit.
Yes.
Okay, so I'm just trying to wrap my head around this because you're right. That position, what do you call it?
Attending nurse.
Attending nurse. So an attending nurse, we don't have it at the hospital I am, but it sounds like you are mixing a whole lot of positions that are already there, right? So there's management that takes care of, the behind the scenes stuff. We have like a nurse supervisor that helps with the, charge nurses that helps with the nurses on the floor, on the unit mostly. Supervisors do like the paperwork, a lot of the management stuff as well. And then case management, it sounds like an attending nurse would be really besties with the case manager because case managers do a lot of that stuff.
Yes.
Right?
Care coordination.
Care coordination. That's what you want to do.
Yep.
I feel like nursing is one of the professions that you can. It's super interpersonal, right? You have your patients. You're always with nurses, all of that stuff. But it's also extremely tedious, and that job that you think that you're striving to get is more on the tedious end. It sounds like there's a whole lot of steps, a whole lot of patients. I lose my mind trying to take care of 4 patients. You try to take care of everyone in the unit.
So give me one task to take off the burden of your assignment. Oh, I really need to get social work to come down.
Yes.
So let me page them for you.
Yo, you need to come to my hospital. That's it. We need an attending nurse. We need an attending nurse. That's the end goal. Awesome. Yeah. I mean, that's good. So we've got all this nursing stuff, and I'm happy.